Welcome to Section 2, Weight Loss Surgery in the Post-Op Diet. My name is Sarah Glynn, Registered Dietitian for the Outpatient Nutrition and Bariatric Program. It is important we discuss diet and lifestyle after surgery for optimal success. Following a precise diet progression after surgery is an important piece to ensure proper healing. Small, frequent, protein-based meals are going to be your focus after weight loss surgery. The diet after surgery consists of 4 stages or phases. Stage 1 initiation starts immediately after surgery and lasts about 1 to 2 days. Here is an example of a stage 1 meal pattern. You can see that all liquids are transparent. This stage is typically low in nutrients and is meant to introduce fluids to assess tolerance. It is important to sip your fluids slowly. A medicine cup, which holds about 1 ounce of fluid, may be provided to you by your medical team to gauge your fluid intake and progress. Ideally, you will be sipping on 1 ounce of fluid every 15 minutes. By discharge, you should be able to sip about 4 ounces within 1 hour. Also note that it is not required to finish your meal. Stop when you feel the first signs of fullness. Stage 2, full liquids. This allows your stomach time to heal properly. The estimated duration of this diet stage is approximately 2 weeks. You may start this diet stage somewhere around discharge and will remain on this diet stage until you receive clearance from your surgeon. Your goal at this time are to make sure that you are staying hydrated and consuming adequate protein. We encourage our patients to aim for a goal of 64 ounces of fluids per day. Your dietitian will help calculate your daily protein goal. It is acceptable to count your protein shakes and other fluids as part of your total fluids. However, try to establish a goal of meeting at least 32 ounces from water per day. Consistencies should be smooth and fall off a spoon easily. Sample foods on this stage would include items such as low lactose milk, unsweetened soy milk, protein drinks, low-carb yogurts, and strained soups. Smaller, more frequent meals may be needed at this stage, depending on your tolerance and to help meet your protein goals. This sample meal plan provides a total of 64 ounces total fluids from both clear and full liquids, and approximately 58 grams of protein. A protein drink or powder can be used to supplement your diet and to assist in meeting your protein goals. It is advised to continue supplementing with protein drinks and powders until you are able to reach your protein goal with food alone. The ideal protein shake will provide more than 15 grams of protein, less than 300 calories, less than 15 grams of sugar, and less than 25 grams of carbohydrates per serving. Here are some examples of protein shakes that would fit the recommended criteria for post-surgery supplementation. Please note some individuals will be more sensitive to dairy after surgery, so looking for lactose-free supplements may help improve tolerance. Drinking only calorie-free beverages between your meals is recommended. If you are having difficulty meeting your goals with water alone, consider the following items to help you in meeting your fluid goals. You will likely advance to stage 3, soft foods, after your first post-surgery follow-up with your surgeon. At this stage, you will be able to tolerate more solid textured foods. These may include items like soft meats, such as fish, hot cereals, such as oatmeal, cooked vegetables, such as steamed zucchini, and soft fruits, such as applesauce. The volume of food eaten will slowly increase as you heal. The expected duration of this stage is around 1 to 2 months. While on stage 3, make protein a priority by consuming your protein first at each meal. At stage 3, it is advised to start your multivitamin and mineral supplements if you have not already done so. Drink plenty of water to meet your goal of at least 64 ounces of fluids per day, and remember stopping 30 minutes before a meal and resuming 30 minutes after a meal. Here are some tips to help you meet your nutrient goals and improve tolerance at this stage. Increase your protein intake by adding protein powder to foods such as oatmeal, yogurt, or soups. Avoid tough and rubbery meats such as steak, dried chicken, or fried foods. Use more moisture when cooking proteins. Avoid bread, rices, and pastas. These types of foods are sticky and dense. They often lead to tolerance issues and are poor nutrient sources. Initially, limit your intake of raw fruits and vegetables. Wait until you are fully healed to reintroduce these. Take teaspoon bites of foods and chew the food until it is the consistency of applesauce. Consume 3 to 6 small meals per day to help you meet your nutrient goals. Add a variety of low-fat, low-calorie starches, fruits, and vegetables to your diet as tolerated. Stop eating as soon as you feel full. Nausea is a sign that you may have eaten too much. Continue to use a protein shake or powder to meet your daily protein requirements as needed. Space your liquids accordingly to meet your fluid requirement. Keep sipping fluids between your meals. When meal planning for stage 3 soft foods, it is advised to start with a protein food first, then pick a soft vegetable, and then a fruit or starch last. The addition of a small amount of healthy fat is recommended to provide balance. To demonstrate, a meal might consist of 1 to 2 ounces of tender, soft fish, providing around 7 to 14 grams of protein, 1 to 2 tablespoons of steamed zucchini with 1 teaspoon of olive oil, and 1/4 cup of unsweetened applesauce. For more details and suggestions, please see page 14 in your education packet for more ideas on meal planning. On page 16 in our packet, you will see a sample menu for stage 3 for one day. Again, focus on smaller, more frequent meals and ample fluids throughout the day. Stop as soon as you feel full. When you are tolerating soft foods well, it is recommended to start your transition to stage 4. For most, this will be around the 2-month mark after surgery. Slowly introduce one new food at a time. Remember to eat slowly and to chew your foods thoroughly. The diet consists of regular textured foods, and it's recommended to continue focusing on protein as well as low-fat and low-sugar foods. Ideally, this will be your ongoing eating pattern. For most, that will be 1,000 to 1,500 calories per day and meeting your estimated protein goals daily. Although exercise and other factors can have an influence on calorie needs. Remember to continue to take your multivitamin and mineral supplements as well. Now is a good time to add raw fruits and vegetables with peelings and seeds, high fiber foods such as whole wheat breads, wheat crackers, nuts, and seeds. Meal frequency may depend on how much volume you can tolerate at a meal. It's important to continue listening to your hunger and fullness cues. To stay on track, we advise tracking intake using journals or apps and consuming structured meals throughout the day. This example may look similar to a meal plan you would follow after reaching stage 4. If difficult to take in this much volume throughout the day, you may want to try replacing a meal with a protein shake. Our bariatric team has compiled a shopping list found on page 19 of your education packet to assist you in making food choices appropriate at each stage of the diet. We have also included 2 pages of suggestions for handling intolerance issues or problems that are common after having a weight loss surgery procedure. This concludes video 2. Our next video highlights vitamin and mineral supplementation after weight loss surgery.